I guess.
All right, good morning. Let's get going on the forum for today.
If you ever have a chance to see
It's a
the
cold day, so I do appreciate you guys getting out, starting the cars and getting here, because it's going to be worth your time. My name is Phoebe Benziger. I'm one of the four that helps facilitate the forum that meets every Wednesday at 8 o'clock to 9 o'clock, starting at 8. We'll be done by 9. A big thank you to Will Woody in the back, who does film this, puts it on the City of Montrose Facebook page. We do have a lot of people that watch that again, so we do appreciate you, Will, for coming every Wednesday morning and filming that. We appreciate Steve Matheny and CMU. There's a big announcement at the end about CMU and how we're going to walk into the building from here on out. There's be a ladder on the roof that you just will So, but anyway, they work with us, we work with them. The building is nice and warm, the acoustics are great, and we really appreciate it. Today's talk, and let me just say really quickly while I have you as a captive audience, there's 4 of us that do the forum. Myself, there's Kathy Heavers, Barbara Bynum, and Judy Ann Files. The last 2 that I mentioned are not here today because you can't be here every day. But anyway, we're always trying to bring something to the table where you leave informed. Maybe you thought you knew everything about that organization, about that person, but we want you to leave with the best information about what happens today is River Valley Health. So I am pleased that they were so willing to come and talk and inform us. They have an amazing building program staff. Their CEO is my good friend, Kaye Hotsenpillar. She's been with them since 2000 and, when did you take, let's see, your bio's right there, Kaye.
Let me see. No, 2018. I started as the CEO last year, so I've been doing it for 1 year.
So she's well known in the nonprofit world. In fact, she has her master's in nonprofits. I've worked with Kaye on a lot of boards in town and currently still do that. So she's wonderful. She brought 2 of her staff that she will introduce and tell you about them. Kaye is a local girl. She was born and raised in Delta. So other than leaving for education purposes, she always came back to where she wants to live and where she wanted to raise her family. She's married to Dan Hotsenpillar. That name may be familiar. He was our former district attorney who is now working with Colorado College, yeah?
Technical school.
Technical school, yeah. Yeah, so they're very interesting. We're lucky to have them in Montrose. River Valley is super lucky to have Kaye. And I will turn this over. As always, I hope you have questions. Try to remember what they are. Ask them at the end. I will bring the microphone to you, and you can ask that, and they will answer the question. So, without taking any more of Kaye's time, I will have introduced Kaye. Thank you.
Thank you. Well, I am joined today by Jeannie Mueller, who is our Chief Medical Officer at River Valley, and she has been there since it started. And then Karen Winklemann, who is our newest senior leader staff, and she started last May or June, right in there. So we are going to be switching between the 3 of us and telling you a little bit about how we became River Valley, a little bit about our services, and where we see ourselves going in the next year. So our history, Montrose Regional Health, back in 1993, they were actually called Montrose Memorial Hospital at that time. They decided that they wanted to open up a clinic in Olathe. And so they did so, and they opened the Olathe Community Clinic. It then moved to a little trailer house behind the elementary school in Olathe, and they combined with the school-based health center at that time. They, at one point in time, they were like, all right, how can we make this clinic be more self-sufficient? How can we move away from it and have it be financially stable? So in 2010, they actually wrote a grant to HRSA to become a federally qualified health center. As you know, being federally qualified qualified, it allows you to be able to have a cost-based Medicaid rate and a cost-based Medicare rate. So it really helps your service provision to be federally qualified. Well, it was denied. So they were told no in 2010. They wrote it again though, and they got it in 2012. And they got it, and then in November of 2012, they decided, okay, it's time for us to step away. Let's create a board of directors, and let's let Olathe Community Clinic become its own entity. And so at that point in time, River Valley came about. And so we have been an entity for 10 years. We're celebrating our 10-year anniversary for all of the next year. As you can see then, we started to expand. And the first thing we did is we remodeled the 308 Main Street location so that we could move out of that little tiny trailer house and into a bigger clinic in Olathe, and that's where we currently reside. That's one of our 4 clinics is in Olathe. In 2017, we partnered with the Center for Mental Health in Delta because we started to look at our data and where patients were coming from, and we were starting to serve a lot of people in the Delta community. And so we worked with the Center for Mental Health and in sharing their space in Delta, and that's where we currently are located, in Delta. We're on one side of the building, the Center for Mental Health is on the other side of the building. At the same time then, we started to look at the patient growth in Montrose, and we found, okay, we need to set up a satellite site in Montrose as well. And so we did so in 2017. In 2018, we began to add substance use disorder services. We have a medication assisted treatment program that we offer through all of our clinics. We then decided we needed to build a building in Montrose. Our leased building was not doing it for us. We had outgrown it. We needed more space, and so we built 1010 South Rio Grande, and we moved in 2019. We added Title X in Montrose. We added dental care in Olathe. And then in 2021, we have and serve a lot of persons that have diabetes, hypertension, high cholesterol issues. And so we hired a certified dietitian to be able to be on staff and to work with our patients that were needing a little help maybe with diet, with healthy eating, exercise, whatever they need to be able to control that chronic condition that they might be dealing with. And also in 21, Delta Health closed their urgent care in Delta. And so it's a little urgent care across the street from the Delta emergency room. And then that served as a huge gap for the Delta community. And a need that was not being filled. And so River Valley jumped in and started the convenient care clinic in 2021, and we currently still provide that service out of that same leased building. And then last year we added a pediatrician, and so our pediatrician is housed in our Delta clinic and is serving kiddos under the age of 18.
Good morning. With our new clinic going back into the Olathe Medical Clinic, which was originally the site before we went into the little trailer clinic, we decided to go with a new concept, and this new concept was team-based care. So you can see in this picture that all of the staff kind of sit in the middle, and then the exam rooms are around. So I sit next to my medical assistant, and then on one side I sit next to the registered nurse. We have other providers, we have behavioral health. So we have licensed practical counselors, and we have licensed clinical social workers. So we all sit in the middle and we're able to collaborate on patients. So I never have to run down the hall and look for a nurse or go and look for my inmate because we're all in the same area. Then we're able to see the exam rooms and we use a flag system so we know where everybody is. And so it makes collaboration that much easier so that it's not just provider driven, it's actually a team of people that take care of our patients. And so on each of our sites, you have a kind of a pod, as we call them. In Montrose, we have 2 pods. In Olathe, we have 1 pod. And then in Delta, we have 1 pod. With that, we also have behavioral health rooms in addition to our exam rooms. So we're able to offer traditional counseling as well as what we call warm handoffs. So say I have a patient that comes in, they're coming in for a sinus infection, but I learned during the visit that they just lost a loved one. So I can leave the room and go out, grab one of my behavioral health providers, and they can go in and serve that patient in the same visit during the same day. We also do that with dental. So we have dental in each of our primary care. So I once had a diabetic patient who came in, a little elderly Hispanic man, who was actually bleeding from his gum. And I said to him, like, let me look in your mouth. And he said, no, I'm not here for my dental. I'm here for my diabetes. And I said, no, we take care of the whole person. And I was able to go into the pod, find the dentist, and he was able to work on that patient that same day. So we have something very, very special at River Valley that we can do what we call a one-stop shop. So you come in for your sinus infection, but you leave with behavioral health counseling, you leave with dental care, and then most likely you're gonna leave with the dietitian giving you some education on your meal planning. So we do offer full kitchens in each of our sites, and the dietitian just loves this. In the end of February, we're gonna start offering a cooking class for our patients, and it's gonna be an ongoing class throughout the whole year. So patients can drop in, they can learn how to cook a breakfast special, or maybe something special for dinner. So our conference room, we have conference rooms in each of our locations. Mostly we do our board meetings in Montrose, and once our new building in Delta is built, we'll be able to go back and forth with having our board meetings there. So we've got a large building, but we're able to offer lots and lots of services. Our Olathe clinic, this is just another picture. I kind of talked about having the exam rooms and the behavioral health rooms. One thing that we also do is we work with local entities to be able to hold food for our patients. So we had food pantries, and so we do what's a screening of social determinants of health. And so during that screening, we can offer patients that maybe are living paycheck to paycheck, they might not have food for the day, and so we're able to go into our behavioral health room, which also serves as our pantry, and the patient will leave with food. We have a lab. Right now we work with LabCorp. In our Montrose and Delta office, we have a phlebotomist who can go in during that same visit and draw your blood. And then we also have our billing, our executive team, and our medical records are housed in our Olathe office at this time. At our convenient care, also known as an urgent care, but in the FQ world, we give it a little twist because we're still offering primary care acute visits, but we've opened it up to the community. So you do not have to be a patient of River Valley in order to seek services at our convenient care. So we can see you for your strep throat, maybe your sinus infection, maybe you accidentally cut your finger while making your meal. We're able to offer sutures and take care of those acute issues that would normally go to the emergency room. So we can free up the emergency room for true emergencies and help the community. In our Delta office, this is actually Dan, one of our providers. We call him Dan the man. He's been there for about 4 years, just a wonderful, wonderful provider. But we work with the dental team again. We've got more dental chairs, we've got exam rooms, and we also have a lab there. So at our new Delta site, we're actually going to have a bigger area to offer access to care. So we've actually had a new doctor start, Susan Bright, who is very, very familiar with the Delta community. She's been there for many, many years, and I actually worked with her when I worked at Delta Hospital. So I'm super, super excited to work with her again. But she started last week, and she will be full-time in our Delta office. We're also looking for another provider to join us as well. But we know that the need is great in Delta, and so we're anticipating adding more services. So the building will actually be a bigger building than the one that we have in Montrose. So we'll have 20 exam rooms, 2 procedure rooms, our dental chairs will double to 7. We'll have 4 behavioral rooms, and we'll have 2 nursing rooms, a lab, and we'll also be able to have a pharmacy. So our pharmacy is very, very special to us at River Valley. Not only are we gonna offer a drive-through for convenience, but because we're a federally qualified health clinic, we have what's called a 340B program. So we're able to offer our patients medications at a discounted rate. So for example, I see a lot of diabetics. I was a diabetes educator before I became a PA. And so I have lots of patients on insulin. And you probably have read in the news how insulin is so expensive these days and that people aren't able to get their insulin. Well, at River Valley, we're able to offer it less than $25 a month for patients with insulin. So there are lots and lots of discounts with working with the federal government, and our pharmacy is one of those. And so we'll have a pharmacy in Montrose and a pharmacy in Delta.
Good morning, you guys. As Kaye mentioned, my name is Karen Winklemann. I'm one of the newer managers at River Valley. I started last May. During that time, we have been working on our strategic plan, and that's a business plan for your business that goes out 3 to 5 years. During that time, we have gotten everyone together, not just the management team, not just supervisors, but all the way from front desk staff to environmental techs. We've gotten them all together and gotten their ideas, their suggestions, which are very, I don't know, they've given us lots of suggestions about how they want to see the River Valley portrayed in the community. One of the things that we went through is changing our mission and vision. There again, we got suggestions from everyone. This is the vision mission that we came up with, and it's brand new. We've had the same vision mission probably 10 years or so. So this is pretty exciting for us. Our mission is to provide high quality healthcare in an integrated and culturally respectful manner to our community. Our vision is to offer affordable and easy access to quality care for all while being an employer of choice. It's interesting how one word can change the meaning of a vision or mission. And we've gone through and scrubbed these, and this is what we have come up with, and I think it's pretty cool. Values at River Valley were patient-centered quality care. We have accountability and integrity and no barriers to care. Our culture, as you guys know, it's really hard to find staff right now, especially in healthcare. I kind of like to pride myself working with River Valley, and I think that we really treat our staff well. We want their opinions, and I think it's been working for us. So our culture, our community, we strive to deliver the best experience in healthcare outcomes to each patient through compassion, evidence-based skills, and patient-centered supports. Teamwork, we understand that teamwork is built through trust, authenticity, safety, and accountability achieved through good communication, flexibility, and dependability. Caring, we seek to understand the needs of others by approaching them with respect, sincerity, and kindness. Compassion, we strive to recognize the basic goodness in everyone and aim for clear communication and self-compassion, to recognize and learn from our mistakes. Growth, we view change and challenges as opportunities to express our diversity and creativity. We use these tools to spark innovation and deliver excellence to our patients and team. Joy, we embrace humor, play, compassion, and gratitude to nurture happy, kind, and effective teams.
So part of what we have to do each and every year is we submit data to the federal government. So we're currently doing that. So it's due February 15th. And this is from 2021 because we're currently pulling numbers for our 2022 population. So this is where our patients are coming from currently. So as you can see, Montrose County, which includes our Montrose Clinic and our Olathe, that is the biggest percentage of patients that we're serving. So about 50% right there. But then you can see in Delta County that those numbers have increased. And thus why we are building a new building, because we have outgrown the one we have, and we have found that it is necessary to have more room to serve more of our patients. So what we use this for is our board looks at these numbers to see, okay, where else do we need to open up a clinic? Where else do we need to grow? So as you can see, Ridgeway, we have 54 people that drive to us from Ridgeway. Grand Junction, we've got 38, and then Clifton. So, I mean, we've got a few people that drive all the way from Grand Junction. So once we start seeing that critical mass, become larger and larger, then our board would look at that and maybe make that decision of, okay, do we need another satellite clinic? So this is our service area.
Like Kaye said, I've been with River Valley or Olathe Community Clinic since the beginning. And when I came on as the chief medical officer, there was one other full-time provider and then one provider that worked 1 day a week. We now have 13 medical providers. We have 4 dentists. We have 4 dental hygienists. We have 5 behavioral health providers, and we have a dietitian. So we have grown and grown and grown. Sometimes I'm just kind of exhausted at the amount of growth that we've gone through, but then I look at our patients and say, wow, we're actually serving and we're providing care. So not only do we do primary care, internal medicine, we do dental, behavioral health. We also have a wonderful community program called medication assisted treatment. So we work with patients in the community that maybe are struggling with opioid use disorder and providing them a safe place to come and get treatment. All of our providers are able to write for medications to help patients with this ongoing battle. We work very, very closely with our behavioral health. In fact, I would say that it's probably more behavioral health based than primary care based. We talked about the pharmacy. We're also implementing a chronic care management program for our Medicare patients. We do provide DOT physicals, sports physicals. It's been a wonderful addition having a pediatrician come on. Just having that knowledge base, being able to incorporate new screening tools. It's just been a wonderful addition to our program. I'm also lucky in the fact that we are able to offer vaccines. We have a variety of different programs. We work with Health and Human Services. We have what's called a Vaccine for Children program. We have a 317 program, and then we have just our private vaccines. So we're able to offer the community those vaccines as well. We work a lot with the different specialists. The general surgeons in our area are absolutely wonderful. We have a lot of connections with oncology, hematology, and we're able to offer lots of screening programs for our patients. Some of the fun things that we do, reach out and read. So when you come to see a medical provider for a well child check starting at age 6 months, they will get a book up until age 5 every time they come in. Studies have shown that if you read to your children and they know at least 500 words before kindergarten, they're more likely to graduate from high school. So we really, really want to incorporate learning as well as making sure that your physical health is met. We do a cavity-free at 3, so we work with our dental program. So when a little kiddo comes in and they're 2 years old and they've got all these wonderful teeth popping in, we're gonna make sure that you get fluoride treatments so that you can keep those teeth and that you're gonna have a healthier outcome. We do lots of classes, like I talked about our cooking class. Matt Chisholm, who's our registered dietitian, he also puts on different classes such as Sugar Busters, and he's getting ready to do a carbohydrate counting class. So we really, really want our patients to get engaged, with different community events as well as classes. A couple of years ago, we took over the Title X program, so we're able to offer contraception and family planning for our patients as well. One big thing is that when I first came on, our patients would say, I'm not able to get to the clinic. I don't have, a car that can make it to Olathe. I would just rather walk to the ER. So we teamed up with All Points Transit, and so we offer our patients rides to the clinic. So we really, really try to think of ways that, maybe a patient wouldn't come because they don't have a car. Maybe they can't afford their medications, so we have the pharmacy. We're always looking at ways to break down those barriers to offer full services to our patients.
So who are our patients? This is our current, it's not our current one. This is our payer mix from 2021. And so like I said, with our UDS numbers, we'll be getting new data on this very soon. A lot of these are pretty much the same. I think our Medicaid is about at 34% right now. But you can see that our Medicare percentages have increased. We serve about 27% of our population are seniors. At the end of 2021, we were at 8,116 patients. We're just over 9,000 right now. 80% are living at or below 200% of the federal poverty level. So that's where you're seeing some of these uninsured persons, some of our Medicaid persons. And then 40% of who we serve are Hispanic, of which 24% of those are best served in a language other than English. And so therefore, we have to really work to ensure we have bilingual staff on site at all times. And so last count, we were at around 34% of our staff speak Spanish and English, which is very good. We also have interpreters in each of our clinics that can help with that translation or that interpretation. And then we have a language service associate line that we can, get somebody that speaks that language on a video or by phone to ensure that we continue to provide access to our patients. This is our patient growth, and as you can see, COVID increased our growth by a lot. So between 19 and 20, we took a 20% increase in patients, and then even between 20 and 21, we increased by 17%. How we also measure that is encounters. So encounters are those visits. So the number of visits that our providers have in a given day is an encounter. And so we went from 22,000, just over that, encounters to 31,000 in 2020. And then between 20 and 21, we did a 37% increase in just those daily visits, those number of times or number of patients that are coming in to be checked on. So with all of our services, all of those visits, we have to have the staff to do the work. And so at the end of 2021, we were at 106 staff members. Currently today, we're at 128. So we have grown. We are providing jobs for our community. We're providing jobs for the Delta community as well. I think we currently have 13 openings. At one point, we were at 22 openings. We have a need for 3 LPNs, which I was delighted to hear there's an LPN program here because we need them. LPNs are the glue that kind of ties our clinics together. They do a phenomenal job for our clinics.
We kind of touched on this, but I wanted to just reiterate the team-based care because I think this is really what sets River Valley apart from other places in the community and other places in the state. So when I walk into the clinic every morning, we have what's called a huddle. So we all get together in the pods and we talk about the day. We talk about what openings there are, who has an acute opening. Do we have any children for dental? Behavioral health, do you have any patients that you want to see from primary care? We talk about annual wellness visits. Who's coming in for an annual wellness visit and what do we need for that day? So that takes about 15 minutes and then we do kind of an icebreaker or something fun and then we start our day very, very positive. So it's not me as a medical provider that drives everything, it's the team. And honestly, I couldn't do what I do without my team, and especially my medical assistant who tells me where to go on a daily basis. No, go to this room, no, you go to this room. We allow our staff to work at the top of their license. When you come in, you may be sick, but you're gonna leave with a mammogram, you're gonna leave with your vaccines, and you're gonna see the therapist. So we really, really strive to provide that team-based care. And we're always looking for ways to improve that and to add to that. We're very, very lucky in the fact that we have different programs. One of our programs is we offer diabetic retinal screening. So we know that high blood sugars can cause bleeding in the back of the eye for diabetics. And so we want to make sure that we're screening on a regular basis. So we have a held hand device that can look into the eyes and it sends the report to an ophthalmologist that we're working with. I'm able to get that result by the end of the day to know whether, yep, you're doing well or do you need additional services. So screening is very, very important. And I cannot tell you the amount of people that we have saved because of screenings. Getting your mammograms, getting your colonoscopies, making sure that you're coming to Well Woman Day. We try to incorporate events to make it fun, but at the end of the day, we're making sure that we're saving lives and we're providing the best care possible.
So we also have a migrant and seasonal agricultural workers program. A lot of the migrant and seasonal workers show up late spring and they work the fields through late summer. We generally try to meet with them. We bring gifts. We have like little packages, but those gifts are actually gloves so that they can use the gloves out in the field. It's sunscreen, it's toothbrushes, toothpaste, those kind of things. When they come into the meeting here, we actually had Jeannie had a group doing their yoga. So that was so they could stretch before they go out into the fields. And it was kind of interesting because at first only one person was over there, but I looked over again and all of them were over there in her section doing yoga. So it's really kind of cool. In 2022, we hosted 8 clinics serving 107 workers, which just was a great program. We did a lot of healthcare for them, and got them interested in the vaccines and stuff like that. So that's our migrant and seasonal agriculture worker program.
And part of our HRSA grant is that we have to, and we agree to serve our migrant and seasonal workers. And so doing outreach to them where they're at is how we have made that work. It's not always easy because they work very long hours. They're out at sunrise and they're still out there working at sunset. And so that's why we go to them and we go to their dorms, which you can see there. That's one of their little warehouses where they eat. So we do full medical encounters, behavioral health screens, and which means just checking for their depression, their anxiety, and the full medical is we're looking at lipids, A1Cs, so we're checking all of those as well as offering vaccines like Karen said. So we couldn't do it without our partners. I see Sarah Curtis in here with All Points Transit. That's one of our primary partners, especially with us growing in Delta, the need for All Points Transit to be able to go up and down the highway. So I'm very grateful for her. We partner with both of our hospitals, and so we have agreements for labs, diagnostics, so that our patients can choose, yes, I want my blood work done by LabCorp, or no, I want to go to the Delta Hospital or the Montrose Hospital. We have care compacts with the specialists in town as well, both in Montrose and in Delta, so that we can transfer patients back and forth, refer back and forth. So it's a great relationship with our hospitals because we definitely need each other, and it doesn't feel like it's a competition in any way. We also work with schools to provide internships for students. And so we have PA students, nursing students that come in and are able to do those hours with our providers. We also, this year, it's pretty exciting, we have what's called a NEMA program, which is one of our front desk staff members that is going through a training to become a medical assistant. So she does some online classes, and then she practices those skills within our clinic, and then she will eventually test to become and receive her medical assistant certification. So that's pretty exciting because we, at this point, have to start growing our own and figuring out how to build up nurses within our communities, and so that's what we are doing. You'll notice that we partner with the Walmart, Safeway, and City Market pharmacies, and so if one of our providers refers or sends a prescription into those pharmacies, because that's what the patients want, then they will still be able to get 340B pricing, regardless of whether it's our pharmacy or those pharmacies. But those are the three that partner with us on that. Future, we want to open up our Delta building May 2nd. I'm hoping for my certificate of occupancy. We are at the end of March, 1st of April, we'll start providing chronic care management. We also want to continue to focus on our staff and continue to grow our current services. So our staff, I mean, we went from about an 84% retention rate down to a 70% retention rate. We've slowly started to climb again, so we're at 73% retention rate. And we have done so by increasing wages. So 11 different job categories have received raises according to our Colorado Community Health Network salary surveys. We were a little bit low, and so we've made those changes for those individuals. And that has helped us to retain staff and also attract new staff. That equaled about a $289,000 cost to River Valley, but that's worth it because we got to have the staff to do the service. We also want to create and enhance our dental services as well as now that we have a pediatrician, what more can we do around pediatrics? You know, how can we build that continuum for our little guys? And then we just want to continue to develop partnerships. So as the hospital is building out south of town, what kind of specialty services will be out there that we can partner with and send our patients to? So we'll continue to look at that and see who else we can partner with. And that's all we have. So what questions do you have for us?
Well, let's give her a round of applause.
Now you can see why there are no barriers to healthcare. I mean, there's really no stopping you guys. So yeah, let's ask questions.
I was wondering, as you were speaking, what is the difference between the PIC place, and River Valley, or are you similar?
We are very similar. So they provide dental, medical, and behavioral health. I think the only difference I would say is we are federally qualified, which means we have a grant that supports us, but we also have to meet all of those HRSA guidelines. So we have a huge focus on quality metrics and ensuring that our patients get their mammograms and colonoscopies because we're driven by the federal government. So we kind of have that behind us, but it also helps us as well financially.
I have to ask a question. What's a phlebotomist? Because on the last slide.
A phlebotomist is somebody who draws your blood.
Okay.
And so, yep.
It's a vampire.
Bad
Jim, I know
It's
you
a
have a
vampire.
question.
So I have this is a very good presentation. I think you covered most of the bases, but I'd like to talk about competition with other providers. You know, you have Center for Mental Health, you have Cedar Point Health, you guys, Montrose Regional Health, Delta Hospital. You know, just a lot of choices for people to make, and apparently you are doing a good job at recruiting and retaining, although it's 70% is not a really a good number. All of these, and matter of fact, we have I think 180,000 or 130,000 square feet of ambulatory care coming in. All these are going to take staff. And so a lot of the problems lie in getting staff is not only wages, but a place to live. How are you dealing with that, you know, that competition?
Yeah,
It's a really good question. We are trying to build up our staff internally, where we're providing money for education. We are increasing salaries, things like that. So just trying to make it the best work environment we can make. Part of our strategic plan is staff focused, and so we're looking at how can we partner with some of our child care facilities to be able to guarantee some slots for some of our staff members that maybe can't find child care, or that's a problem for them. Housing, we continue to struggle with, and it's also on our strategic plan to figure some of that out. I know that Eva Veach is in the room, and I know she and Carlton Mason and Hilltop have some different housing projects that they are actively working on. So I know as a community and as a community member, that's something that we will be a part of to ensure there's proper housing. But you're absolutely right. With the new ambulatory center, we will be competing for staff, and that is an issue. And I think that's why we need Steve. We need the Technical School of the Rockies. You know, continuing to offer the education and build some of these staff for our local needs.
The city's doing a study on housing, and the county has a housing committee going on. Are you guys part of that?
We are not. Would love to be though, so I need to look into that. So there's like groups that are meeting around those issues?
Right, and the city
Okay.
probably is the biggest one. They have a consultant that's in it. They're doing community surveys and things like that. And none of the questions relate to providing workforce housing for medical personnel.
Yeah, okay.
Hi. Thank you for being here this morning. It was a great presentation. I'm just curious about what is your chronic care management program? What does that look like so far?
Well, actually, we are partnering with an outside facility who will have access to our EMR. So they're registered nurses and will work with this company, and they will actually be able to reach out to our patients and work with our providers. And so it'll just be a collaboration with this organization to provide that chronic care management and that ongoing kind of relationship with the patient. So they'll be reaching out to the patient, setting up care plans, and then working with our River Valley providers to make sure that when they're coming in, everybody is meeting as a team.
I would be really interested in partnering with you on that for our elder population. So let's get together.
Okay, sounds great.
Yeah, and that's who it's gonna target, Eva. So it's seniors or persons on Medicare that have 2 or more chronic care conditions. And so, and I think another piece of our strategic plan is to do more around Medicare, fall prevention, doing some classes with your agency. So you are on my list to contact, but our board just approved our strategic plan last week, right, Kelsey? So it's coming.
We'll talk soon. Thank you.
Hi. You mentioned doing screenings and mammograms and stuff like that is something sensible and good and not controversial. Could you comment about your policies or programs on vaccinations, and to what extent do you see a role for yourself in exercising leadership about having vaccines, or is it kind of your policy or practice to avoid topic of vaccines because it intersects with political issues?
Are you referring to our staff having vaccines or our patients getting vaccines?
Both, please.
So, as a medical provider, I'm gonna back vaccines. There's lots of data, science, we could have a whole nother forum about vaccines. So that is something that we do offer our patients. Like I said, our medical assistants and our nursing staff, when you come in to see me as a patient and you're due for your pneumococcal 20 now, they're gonna go ahead and give you that vaccine. So the nurses initiate that conversation, they go ahead and give the vaccine. If there's questions, then me as the provider will go in and have that conversation with our patients. So we, offer a plethora of vaccines, and I am very pro-vaccines. As far as staff, we're a medical facility. We're gonna come into contact with influenza. We're gonna come into contact with whooping cough or pertussis, hepatitis A, hepatitis B. So it's my job as the CMO to make sure that our staff is protected. And part of that is getting vaccines. And so we do have requirements for vaccines to work in our office. So if you have specific questions about specific vaccines, we could take that offline.
Well, as a follow-up question, or could you comment about the COVID vaccine and to what extent you're actively try to change public perceptions about taking vaccines and about getting the COVID vaccine? Or do you already see that that's not your responsibility because it intersects with political matters?
No, I think that's a good question. As a medical provider, can we do better at educating patients and the community? Absolutely. Did it go as planned for the COVID vaccine? Probably not. Could have taken some different steps to educate the public. But as a medical provider and my colleagues that I work with, we do take the time to talk about, what's been said on TV and what they've heard. And we're able to have those conversations in a safe environment. And then it's up to the patient whether they get the vaccine. And so we've been able to kind of, have those difficult conversations, and some people get the vaccine, some people don't. But I'm not gonna stop caring for those patients. My job is to educate and not force onto somebody. We as an entity, as River Valley Family Health Center, because we do get federal funding, we were in the mandate for our staff to have the COVID vaccine. So we were part of that kind of overall with the mandate. And I think because we work in a medical facility, our staff understand that, and they got the vaccine.
Good answer. I'm curious, do you guys offer shingles vaccines, the two-part?
Yes, we do.
You do, okay. Do you guys also do telehealth at all?
Do what?
Telehealth visits?
Yes, we do. So that, and I forgot to mention that with our services, that came about during COVID. And we found that lots of patients actually enjoy being able to stay in their home, safely in their home, and they could talk to me. Or they could talk to the behavioral health therapist, or they could talk to the dietitian. And so that's something that we've actually kept now that people are coming back into the clinic. And it's actually worked out really well. So if we have a staff member, maybe Dr. Raffinelli is not feeling well that day, she can stay at home and the patients come in and they can still see her through telehealth. So it kind of works back and forth. But yes, we still offer a variety of services through telehealth.
It's a pretty small number, like 2% is all that really uses it, but still.
It's an option.
It's an option.
How many of your clients are homeless?
Oh goodness.
Did you already ask your question?
I would say less than 1%. But we know that, and I'm speaking for Delta, because we see a lot of those clients come through our convenient care clinic. And so we're working on, especially with our behavioral health, to outreach to them. And we're hoping to offer some vaccines later this spring. We want to go out to the different communities and offer vaccines and medical care.
And that was huge, because when the county shut down, Montrose County, their vaccine program, you guys were quick to pick that up, because that was kind of a panic mode there for a little while of where we were going to be able to send, especially school-age children, to go get vaccinated.
So we do work with the county to offer VFC, which is vaccines for children, in 317. So if you qualify for those two groups, then yes, we will vaccinate you.
Yeah.
Absolutely.
Any more questions? Anybody? You guys, that was a great presentation. I do want to introduce Kelsey. She's your Chief Financial Officer.
She's our treasurer.
Treasurer. So she's
On the board.
Hi, how are you? She's here. She's one of the cogs in the wheel for River Valley. But anyway, let's give them another round of applause.